You need to know the 10 strategies to prevent anaphylaxis in your food allergic children. The 10th strategy is to be informed of updates and new treatments for food allergic individuals. So there are 3, and then I'm going to add a few other little things. But one of the things that we have learned is that, especially recently, there is a number of new treatments available, not to cure food allergies. We haven't gotten that far yet. But there are strategies that will help increase that threshold and prevent your child from having a life-threatening reaction. So one of those was Xolair. And Xolair was a medicine that has been available for the last 21 years. And on February 16th, 2024, it got an indication to treat food allergy in individuals 1 year to 55 years of age. And again, it's not designed to treat an anaphylactic reaction. It is not a replacement for avoidance of those foods. It is designed to prevent a child from having a life-threatening reaction upon the ingestion, an accidental ingestion of the food that they may be allergic to. So the study that they looked at, the study that was performed rather, that looked at these individuals that had food allergy, found that after 16 to 24 weeks, these individuals could ingest about 2.5 peanuts and not have a life-threatening reaction. This wasn't 100% of them. It was between 60 to 70% did not have an anaphylactic reaction if they received this injection, this every 2 to 4 week injection of Xolair. And then what they did is they did an open label extension trial, and they found a significant decrease in serious reaction to eggs. They decreased their reaction rate by 67%, milk by 66%, and cashews by 42%. So this is the only product of its kind that has been shown to treat children a year up to adults 55 years of age to prevent an anaphylactic reaction to peanuts. And they looked at milk, eggs, and cashew. That's what the literature has shown. So that is huge. Another medication that actually has been available since 2015 is Palforzia. And Palforzia was directed to, again, increase the threshold, prevent children, and it was in children 4 to 17 years old who had a peanut allergy. And this particular product could be swallowed. It was peanut protein that was in a form that could be swallowed, as I mentioned. And what it did was prevented children from having a life-threatening reaction upon an accidental exposure of peanut. Again, it is not a cure. It's not designed to treat anaphylaxis. It was completely designed to prevent anaphylaxis for an accidental ingestion. So it's not advocating that children start eating peanuts, but they had to maintain this threshold by ingesting the peanut protein every day. There could not be a break in the peanut protein ingestion. The other study that I wanted to comment on was called the LEAP study. And the LEAP, L-E-A-P, was learning early about peanut allergy. And it was published in 2015. And it was kind of an amazing study because for decades we told parents not to feed children peanuts until they were at least 3 years old. And then what happened is they found that children of Jewish heritage, these Israeli children, had a lower risk of having peanut allergy, and they were trying to figure out why. And they were comparing it to children in the UK and found that these children were Jewish children who had been ingesting these peanut products were less likely to develop peanut allergy as they aged. So from there, the US did their own studies. In fact, FAIR, that group that I have mentioned to you before, the Food Allergy Research and Education Agency, contributed funding for this particular study. And that what they found is that the earlier the introduction of, or I shouldn't say the earlier, but early introduction of peanut protein into a child's diet decreased their risk of developing peanut allergy. So that is pretty huge to prevent peanut allergy. And the children that were at high risk were those that had the egg allergy and those that had moderate to severe, or I should say moderate eczema. And what they found is introducing peanut protein between the ages of 4 and 6 months actually decreased the risk of developing peanut allergy by 80%, which was just huge. And perhaps if we had known that information when my children were growing up, I wouldn't have any children with peanut allergy, but that wasn't available at that time. But now it is. So keep that in mind. That, and then there's other strategies. So there are many things in the pipeline right now. There is this, again, a patch, the epicutaneous patch that goes on the arm, and it releases a small amount of the protein, the food protein, to again increase that threshold and prevent anaphylactic reactions. And there's also tablets, or I should say liquid, that dissolves in your mouth under the tongue, that have also been shown to prevent anaphylactic reactions. And then oral immunotherapy, where again you ingest that particular food. None of those strategies have been FDA approved. The only two strategies that have been FDA approved are the only two products. That one is Palforzia and the other one is Xolair. And then the LEAP study is informational, but extremely important information. So I want you to know that, be up to date, maintain vigilance, and let's try and protect our children as much as possible. And let's see if there is something to cure these children with food allergies.